Good morning, everybody. This is Anna Keenan. I'm running to be the Member of Parliament for Malpeque with the Green Party. I wanted to make this video today to talk about some of the biggest issues in the campaign, both related to healthcare, and they are Pharmacare, Universal Pharmacare, and the conditions of work for our nurses. Starting with Pharmacare. The Green Party has supported truly universal Pharmacare for decades now. We've had it in the Liberal Party platform. I think Pharmacare was first mentioned, or making steps towards universal Pharmacare was first mentioned 24 years ago in 1997. And I honestly think it's well past time for universal Pharmacare to be implemented in this country. We are the only country in all of the OECD that has what claims to be a universal healthcare system, but that doesn't cover the costs of prescription drugs. So you can go for free to see a doctor, and they can tell you for free, you need to take this drug to, keep your health in check, to keep you alive, to make sure that you don't get worse symptoms. But then you have to pay for that out of pocket. And for people who are in poverty, people who are low income, sometimes prescription drugs, they can cost $400 a month for insulin, for example, and people have to choose, am I going to take that drug or am I going to put food on the table for my kids? And so we see a lot of people in Canada at the lower income levels who are choosing to forego their prescriptions or to stretch their prescriptions, or maybe not to take the full course. If it's a multiple month course, maybe they'll just try to take 1 month and say that's enough. And then we end up with people getting complications and landing in our healthcare system. And as we know, our healthcare systems are desperately overburdened at the moment. Universal Pharmacare is probably one of the biggest ticket items in a federal budget. I think the estimate that I saw in the last election was that this would cost $30 billion a year. It's a lot of money, but it is also something that pays for itself and that we should do. It's the morally right thing to do, and it also makes financial sense because our nurses and doctors, they've been advocating for Universal Pharmacare for a very long time. They're sick of seeing patients that could have had their illnesses solved by taking their prescription drugs. When people, for example, don't take insulin, they can get heart complications, they can get amputations, and that adds to the backlog in our system. So in a context where we're short on medical staff, one of the best things that we can do is provide universal Pharmacare. The Greens are in full support of this. The Liberal proposals would have us getting Pharmacare towards 2027, which is conveniently outside of the next 4-year window of government. If we elect Greens into this Parliament, we are going to push to implement Pharmacare in this term of government, not waiting for one more election. We need to get it done for Canadians and start getting results. The second thing I want to talk about is nursing shortages. So we have had here on PEI a lot of reports in the media in the last month talking about a toxic work environment. And as I've gone door to door, I've heard all sorts of different nurses saying, that word is totally accurate. And then I've heard others saying, I don't think that word is fair. It's a very controversial word to use. What does toxic work environment mean? What we do know is that we are missing 1/4 of our nursing complement for PEI at the moment. 1 in every 4 nursing positions on the island is vacant. And this is not a problem that's unique to PEI. It's particularly acute here right now, but we are also seeing medical staff shortages across the whole country. Why is that? Yes, a toxic work environment exists in some areas of our workplace, of our Health PEI workplace, and that needs to be addressed. My colleagues in the Provincial Greens have been pushing really hard to make sure that the results that we're finding from exit interviews are found so we can increase retention rates. The shortage of staff leads to overwork and staff are unable to get a break. One of the other things that I've heard, though, as I go door to door is some nursing, I've even spoken to nurses who've quit, and some of them have said, even if they paid me twice as much, I wouldn't want to do that job anymore because the way that we've structured nursing now has become so bureaucratic and so sort of machine-like that it's very impersonal. And they got into nursing because they wanted to care for people, but they felt like the way that the system has been structured, the bureaucracy of it all has meant that they're feeling more like a cog in a machine, and they're not able to give that personal care that they dreamed about when they got into first studying nursing. And so if we want to attract nurses to the profession, and it is a noble profession, a good profession, something that we should really respect in society. We need to be listening to what the nurses are saying about how they would like to work, what would be a rewarding workplace for them. And then we need to act to structure our systems so that our staff can work in teams, so that they feel supported, and so every day that they're going home they feel like this is a rewarding job that's good for their soul, so that they can give care to others. We need to care for our medical staff so that they can care for us. That's pretty abstract. It's not, specific promises of, if the Greens form government, we're going to spend X billion dollars on this and Y billion dollars on that. The Greens are obviously not going to form government this election, but we can have additional Green voices advocating for change within the system, and that's where I would like to be. I don't trust either of the two major parties to do well on healthcare if they form a majority government. So my ideal outcome from this election, especially for healthcare challenges, is that neither of them forms a majority. They're both kept to a minority, and we've got progressive voices in the balance of power that can call for implementing things like pharmacare and restructuring the way that we're operating our healthcare systems. Thanks for listening.